Her doctors told her she's dying. She had stage 4 lung cancer. She had chemo for a couple years, and she stopped it 3 years ago. She has all kinds of symptoms. We worked her up, got blood tests, staged her up, and guess what? She's in complete remission. So lots of patients that see us don't need treatment, and thank God she didn't have any active cancer. She was shocked when she heard that. We have a caller to our phone number 212 Choices. Good morning.
Good morning. I just had a question. Have you ever treated Merkel cell cancer?
Yes, we've treated lots of people with lots of Merkel cell, and it's very successful. Usually the Merkel cell melts away either in the primary site or the metastatic site. So the answer is yes, yes, yes.
Well, my father-in-law, who does live in Texas but can't fly, has Merkel cell, and he's had several surgeries. He's had chemo, which nearly killed him. But they kind of told him that they can't do anything. He's asked about radiosurgery, and they said, oh, no, that won't work.
Well, actually, we have a patient. I had a patient just like him, a famous judge in New York. Went to a big cancer hospital in New York. He had an excision just like your dad. He got infected. He got super infected in the hospital. And while he was 6 months convalescing, the cancer grew right back. He came to us. We treated it. It went away. So usually it's just 5 treatments. What?
Does it return?
90% chance it will never return. This gentleman and most patients, it will never return where we treat it. So the big appeal is it's very sensitive to radiosurgery. Radiosurgery allows us just to focus the treatment on this kind of skin cancer, and actually we're treating many skin cancers now, Merkel cells and also squamous and basal and melanomas. And Merkel cell is particularly sensitive. It's maybe unknown in the medical community, but it's a very effective treatment.
Well, praise God. Okay, well, I will let him know, and we will try to get in touch with you.
Right, do that. Call during the week, and if you call that our number, the 212 Choices, we'll send him and you a booklet about our work and DVD.
Thank you. Will do.
Thank you. God bless you.
Thanks.
Bye now.
Bye-bye.
So, yes, we are treating many people with skin cancers right now. We have one man coming in from Connecticut with 4 skin cancers on his hand. We're treating them all simultaneously. We have another gentleman with 4 cancers on his face, 1 under the eye where surgery would be very deforming, and then 3 on his forehead would also be deforming with surgery. We're treating them all simultaneously, so he's getting 4 for the price of 1, and he's happy, doing well, no side effects, very well tolerated treatment. I want to talk about several other cases today. We have so much to talk about. Really, I don't know why. It was such a busy week with news and with patients. Here's a woman, 34-year-old black woman, mother of 5, who presented in 2008 elsewhere to a hospital with loss of consciousness. She blacked out. She had an MRI. She was found to have a large tumor in her head. She was never had the tumor removed or treated with radiosurgery. She's been treated with medicines and has more and more symptoms. Excuse me, we're just going to take this caller. Good morning, Radiosurgery New York. You're on the radio. Good morning.
I would like a booklet, please.
Okay, just call our number, the same number during the work week, Monday through Friday, 9 to 5, and we'll put a booklet in the mail at no charge.
Thank you very much.
Okay, bye-bye now. So this woman blacked out, had a big tumor, was never treated to make the tumor go away. She was given medicines to kind of placate the tumor, and now came in this week on Wednesday, and I examined her, and she's lost about half of her vision in both eyes. So this tumor, this pituitary tumor, is pressing up against the chiasm. It's destroying her vision. It's going to make her blind if it keeps on growing. Incredible. And no one ever offered her treatment to try to get rid of the tumor. So what are we doing about it? Well, number 1, we're getting all these records from that hospital. Number 2, she now has a doctor that she can call day or night. Number 3, we're restaging her with a new scan of her brain. Number 4, we're getting formal visual field so we can see how much of the world she can see. And then number 5, we'll make recommendations to try to save her vision so she can be a productive citizen and a mother. She's a mother of 5. So, wow, how a visit can change, and hopefully for the better, change her life with this pituitary tumor that's causing her to go blind, headaches, and severe pain. We hope to help her immensely. Another patient this week. Patient came in, 72 years old, man with his girlfriend. He's divorced. He had rectal cancer. He had colonoscopy. He missed the colonoscopy. He had it after a 9-year hiatus. 3 years ago, he's found to have a low-lying rectal cancer. He had chemoradiation and then surgery. And now the cancer's come back. He's had multiple chemos, which didn't work, and he came to us for radiosurgery to treat the cancer in the liver and lungs. Our success rate for colon cancer, we gave him, is about 90% where we attack. We spoke about all other methods of treatment. That's something that I do with all the patients. It's funny, the first patient I talked to you about, the doctor won't see the patient, didn't even tell her there's other methods of treatment, like fractionated stereotactic radiosurgery with no screws in the head. And this patient never knew there were other treatments besides chemo. Well, why is it? Well, the chemo companies are paying hospitals and doctors tens of millions of dollars. And many doctors are then appointed to the boards of the chemo companies. So the chemo companies are paying the hospitals. The hospitals are sending their doctors to be on the boards. So it's a little bit incestuous. As I spoke to that caller from New Jersey, we work for the patient. We do not take money from drug companies. We do not take money from radiation companies. We don't take money from anybody. We get work by each patient. We take your insurance, Medicare, Medicaid. Our costs are significantly lower than the hospital costs. I told you that woman was getting billed for $70,000 after insurance already paid $30,000 to that big hospitals. Yeah, hospitals charge a lot of money. Who's paying for the building and their advertising and their full-paid ads in the New York Times and the CEO getting $2 million? Someone's paying, and it's probably you or your neighbor. We have another patient who came in, interesting woman, who's an 81-year-old woman from India. She has 3 children. With her, she actually has 8 children total. In 2013, she had what was thought to be a goiter, which is goiter is a tumor of the thyroid. But actually, she had a squamous cancer of the neck starting from the oral pharynx. She went to a super big cancer hospital nearby. She had chemoradiation, standard radiation, from September 2013 till March 2014, and actually the cancer just grew back. She had more chemotherapy, no change. She had a PET scan at the big cancer hospital showing that the cancer is progressing. She came to us. She's had a trach in place for a year. She's had a feeding tube in place for a year. She hasn't eaten in a year. Wow. Now, she was given all those tubes for fear of something, but she never had anything that would justify those tubes. So she has a lousy life. The cancer's growing back in one area. So great case for radiosurgery. With us, we would offer focused beam, fractionated stereotactic radiosurgery for head and neck cancer. The vast majority of cancers will stop or shrink or go away. And you can see pictures in our booklet for brain and head and neck cancers, which actually show massive cancers of the head and neck going away or gone after radiosurgery. This woman was told about that option, and she's hot to get treated. I spoke to her 3 children. They all know the options. We spoke about all options, which I do with every patient, because I think every patient deserves to know the options about what's available for them. Chemotherapy has basically no chance of putting her into a durable remission. It might work temporarily like it did last year for a few months, but radiosurgery has a high chance, about 90%, of stopping the cancer where we aim the beam for the rest of her life, and that's our data based on many, many patients over many, many years. Hey, Dr. Oz finally got called to Congress for talking out of the wrong side of his body. Well, we've talked about Dr. Oz before, and finally he went to Congress. This was an article from AP. Went to Congress this week, and it said, this is an article by Alex Block. Dr. Oz was put on the defensive Tuesday after appearing before a U.S. Senate subcommittee where he was taken to task for calling a weight loss product of questionable value. He called it a miracle in a bottle. And he was admonished for medical advice, news, and entertainment in a way that harms consumers. And he said, I recognize that my enthusiastic language has made the problem worse at times. Well, there's lots of criticism of Dr. Oz that he's promoting vitamins and supplements which have no scientific basis. The problem with Dr. Oz is, of course, he's a board-certified doctor in a big hospital, and when he says things, people expect him to say the truth. Well, it seems now that he's apologizing for all this stuff. Senator McClaskill said, I don't get why you need to say this stuff when you know it's not true. When you have this amazing megaphone, why would you cheapen your show? And she went on to say, the scientific community is monolithic against you in terms of the efficacy of the 3 products you call miracles. She said his endorsements give viewers false hope, whether intentional or not. And he was grilled about Pure Green Coffee, which was promoted. He was on the hot seat. He said he's just a cheerleader for the audience. Well, later on he said, I'm accountable for my role in the proliferation of these scams. He called them scams. And I recognize that my enthusiastic language has made the problem worse. So there's Dr. Oz going down the drain because he promoted products that have no scientific basis. I know many listeners are in awe of him, and that's sad because he's probably a fine cardiac surgeon. He went to Harvard College, a fine school, but he's off the track, and he's finally being called to task by the U.S. government and by many of his colleagues, which we've spoken about here before. So please be careful. There's not too many miracle pills that make you lose weight and do all those things that he led you to believe happens. We had a gentleman come in this week who I've been following for 3 years, a black man, about 60 years old, works, very nice man. He first came to me when his PSA was in the range of 3 to 4. He had had a biopsy which was negative. Over the last 2 years, his PSA is rising, and I've warned him about that rise in the PSA. Came in last week, and his PSA went up to 10.91. Now, it used to be in the 3-4 range. So it's more than doubled, almost tripled. I've arranged for him to see a urologist and get worked up. Obviously, if you have prostate cancer and are treated when the risk factors, and the main risk factor is the Gleason score, which is how the cancer looks under the microscope, and the PSA. When you get treated with a lower PSA and lower Gleason score, you're more likely to be cancer-free. And there's now studies, randomized studies of people who have watchful waiting versus treatment, and the group that has treatment live longer with less death and less death from prostate cancer. So this gentleman knows the facts. He's getting worked up. We'll report back to you about him. We're going to hear a word from our sponsor, actually some new voices about radiosurgery and cancer treatment. We are a cancer treatment center. You can call us at 212-CHOICES if you have a question. And here is a word from those voices.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212 Choices, 212